Okay, so the next part now is we discuss the stages of labor. Again, the first stage of labor begins when we have determined that there is already true uterine contractions, and it should end with full effacement or dilatation, or cervical dilatation of 10 cm, cervical effacement of 100%. Now, sa lahat ng stages ng labor, first stage is the longest stage. In fact, it's even divided into three phases: the latent, the active, and the transition phase. The latent phase is when the cervical dilatation is 0 to 3 cm. It begins with true uterine contractions, but they are just mild and short. Ang duration niya 20 to 40 seconds. Pero pahaba ng pahaba siya as the stage continues. It lasts for about 4 to 6 hours, and si mommy nakakaramdam ng minimal discomfort, but still the mother can walk. Pwedeng maglakad ang nanay sa first stage of labor basta't hindi pa pumuputok yung kanyang panubigan. That's the criteria. Second is active phase. Active phase is 4 to 7 cm dilation. Dito, the contractions grow strong, which really show true discomfort. Masakit na masakit for the mommy. It lasts longer, 40 to 60 seconds. And dumadalas na siya about every 3 to 5 minutes. Okay, if we look at the previous discussion, ang maximum duration ng contraction is 40 to 90 seconds. Ang maximum frequency niya every 3 to 4 minutes or 3 to 5 minutes. No? Dito, pagdating ng active phase, we estimate that cervical dilatation is approximately 1 cm per hour. For example, it's a 4 p.m., nasa 4 cm dilation. Normally, dapat 5 p.m., 5 cm dilation na. So, pagdating ng active phase, ang pagbuka ng cervix expected to be 1 cm per hour. Kaya kung titignan nyo from 4 to 7 cm or 4 to 10 cm, ilang oras yon. Ganon din kahaba yung labor. Also in the active phase, normally we expect show and rupture of membrane. Kaya sa active phase, hindi na pwedeng maglakad-lakad yung nanay, lalo na pag pumutok na yung kanyang panubigan. Third is the transition phase, 8 to 10 cm. During this phase, contractions reach peak intensity, duration, frequency. So mas dumadalas na siya, and mas tumatagal yung duration ng contractions. Here, na-achieve yung complete or full effacement and dilatation. Dito rin minsan nakakaramdam yung nanay ng irresistible urge to push. Naiiri na siya, pero tatandaan hanggat hindi pa fully dilated at 10 cm, hindi pwedeng mag-push ang mommy. Remember the pregnancy exercise on breathing techniques where we teach mommies to blow on each exhale? The mother should do that kung meron siyang nararamdamang irresistible urge to push pero hindi pa naman 10 cm ang cervix. Why? Kapag ang mommy umire at hindi pa siya 10 cm, baka magkaroon ng cervical laceration. Okay? In the first stage, admission to labor is recommended. Meaning, hanggat wala pa sa active phase yung mommy, no? I mean, admission to labor when the parturient is already in the active phase is recommended. Which means, normally ina-admit sa labor room yung mga nanay kapag at least 4 cm dilated na. That's the new recommendation of EINC. Okay, ito yung sinasabi ko na merong mga evidence-based researches. Okay? Second, Encourage women to bring with them someone they trust or feel comfortable with during labor. Before, basta't nagle-labor na yung nanay, hindi na pwedeng pumasok sa labor room ang kahit na sino. Pero EINC says pwede niyang isama sa loob ng labor at delivery room yung tao na para sa kanya ay best support person. And for a mother, of course, the best support person is the husband. If the husband is not there, at least someone the mother um, who feels comfortable with. Of course, we should respect contraction time, address and intervene for anxiety ng mommy, and monitor and treat kung nakakaramdam siya ng hyperventilation because of the discomfort that the mother is feeling. Okay? Again, ito ulit yung evidence-based research. So I will not go through with it, but you can read there the results of the evidence-based research. Kaya ito yung nire-recommend ngayon ng EINC. Kailangan may continuous maternal support. And again, the best support person is the husband. And this will make the labor and delivery process more successful according to the researches. Next, there is no evidence supporting strict bed rest in supine position during the first stage of labor. In the absence of complications, women should be encouraged to change to positions they feel most comfortable in or move around during labor. Dati kasi, basta through contractions na yung mommy, ang practice, strict bed rest. Okay? But now, the mother can have the freedom of movement as long as comfortable siya sa first stage at again, hindi pa pumuputok yung kanyang panubigan, evidence-based research, hindi kailangan na naka-strict bed rest. Alright? Kung sa photo, ganito yung gusto niyang posisyon, ganyan siya komportable, kailangan support si mommy. Another photo, iba-ibang posisyon, ina-assist siya ng husband niya. Ang importante dito, may freedom of movement. And we can also promote change of position. Ang mga result ng evidence-based researches, again, mas nagiging successful ang delivery at less or walang nangyayaring complication. Okay? Now, going back to the checklist na binanggit ko, which is yung inyong EINC checklist. Okay, ito yung unang-una. So, I'm sure i-memorize nyo itong part na ito kasi EINC read them nyo ito. Okay, the EINC checklist is based on EINC at again, babalikan natin yung RA 10354, Responsible Parenthood and the Reproductive Health Act of 2012. So, kailangan masunod ng bawat delivery facility yung protocol. Okay? Now, prior to the mother's transfer to DR, kailangan position of choice. So, again, any position of comfort. No? Tanungin siya, gusto ba niyang kumain, gusto ba niyang uminom? Pwede siyang kumain, pwede siyang uminom. As long as yung mga kinakain niya ay madaling ma-digest. Okay? Kailangan kumain at uminom ng nanay. Bakit siya importante? Kasi sa hinaba-haba ng labor process, ginuto mo pa siya, uhaw pa siya, tapos sasabihin mo sa ending, mommy push. Wala na siyang energy to push kasi gutom na siya. Before, ganoon. Pero ngayon, as long as nasa first stage of labor, pwedeng kumain yung mommy. Pwedeng uminom yung mommy. Hindi kailangan na NPO. And of course, communicate. Okay? But prior to this, no, kailangan sa isang delivery room, in advance, meron na tayo mga nakaprepare na decontamination solution. Dito tayo magde-decontaminate ng mga materials na gagamitin natin based on the EINC checklist. You can mix 1 part of 5% chlorine bleach to 9 parts of water, or 10% chlorine bleach and 90% water. This is to make 0.5% chlorine solution. Usually, nasa kidney basin yan sa isang DR. Or, minsan, yung mga ospital, commercially bought Sidex solution as a decontaminant. It should be changed at the beginning of every day or when the contamination is already cloudy. That's very important to prepare. Okay? Ngayon, pag nasa labor room na yung nanay, it's very important. This is so important. Pag nasa labor room na ang nanay, according to EINC, lalo na pag nasa active phase na siya, we have to start plotting in a partograph. Okay? And this is a partograph. A partograph is a tool used to assess and manage labor. It will guide the birth attendant to identify women whose labor is delayed and therefore decide appropriate action. Plotting in a partograph will definitely avoid unnecessary interventions so that ma-reach natin yung goal, yung SDG, yung goal before ng MDG, na ma-prevent ang maternal and neonatal mortality and morbidity. Okay, ngayon ito yung itsura ng isang partograph. Please download or print a partograph form for you to practice, and you also need this for our exercise. So, ang partograph form ay may 3 components. Progress of labor is first. So, makikita nyo dito yung cervical dilatation, 4 to 10. Bakit 4 nagsimula? Kasi nga, ano yung sabi natin? EINC recommends that partograph or admission to labor should start in the active phase. In active phase starts at 4 cm dilation. Second is maternal and fetal condition. Dito natin makikita yon. So, nandiyan sa maternal condition yung vital signs ni mommy, blood pressure, pulse rate, temperature. Okay? Also, kung siya ba ay nakaihi or hindi. Bakit importante yung pag-ihi or hindi? Because a full bladder can actually halt normal labor progress. Okay? Fetal conditions, syempre yung fetal heart rate is important. This is what we need to remember in a partograph. The first diagonal line that you see is the alert line. So, ang tawag dyan, alert line. The second diagonal line that you see is the action line. At yung dalawang lines na yan are very important so that the birth attendant will be able to determine problems along the way habang nagle-labor or nanganganak si mommy. And again, ito yung mga dilation or dilatation, 4 hanggang 10 cm. Okay? Now, ano mga kondisyon yung hindi kagagamit ng partograph? Pag may hemorrhage, pag may severe preeclampsia or eclampsia, pag may fetal distress, pag dating CS, yung previous deliveries, kung may multiple pregnancy, kung may malpresentation, meaning transverse presentation or shoulder presentation, or transverse lie, or shoulder presentation or breech presentation. If the baby is very premature or merong obvious obstructed labor. So, ang partograph sa normal vaginal delivery lang. Alright? So, again, ito yung partograph. How do you plot in a partograph? First step is to start by writing pertinent information of the mother. Siyempre, pangalan ng mommy, kailan na-admit, anong oras na-admit, OB score, LMP, EDD, ano yung age of gestation niya ngayon, at later on, you'll be able to fill up yung mismong time of delivery. These are just some of the pertinent information. You write it on the white part on the upper left side corner of the partograph. But, pwede rin kayong maglagay dyan ng iba pang pertinent information about the mother. Alright, that's the first step. The second step is to begin plotting the first dilation from the first IE. And you will do that on the alert line using capital X. Pag sinabing IE, nag-internal examination ka at na-determine mo doon yung cervical dilatation. Okay? Again, you only start when the woman is 4 cm or more. And the contractions are actually 3 to 4 in 10 minutes. So for example, dumating sa'yo yung nanay, pagka-IE mo 4 cm, ano yung unang-unang gagawin? I-plot mo yung 4 cm. Saan ka dapat magpa-plot? Ang titignan mo ay yung alert line. This is the alert line. Sa alert line, nasaan yung 4? Ito. So, dito mo ipa-plot yung X. Okay? Another example. Dumating sa'yo yung patient. Pagka-IE mo, 7 cm na. Okay? Pagka-IE mo, 7 cm na. So, ano yung first plot mo? First IE, 7 cm. Again, ano yung unang titignan? Alert line. This is the alert line. At ano yung ipa-plot ko sa alert line? Nasaan yung 7 cm sa alert line? Ito siya. So, dito mo ipa-plot yung X. Alright? You will always plot the first dilation on the alert line. So, pag dito mo plinot yung 7, mali na yung partograph mo. Pag dito mo plinot yung 7, mali na. Pag dito mo plinot yung 7, mali na. And so on and so forth. Saan dapat yung first plot? It should be on the alert line. So, ito yung una mong titignan at yung first IE mo, dun dapat sa alert line. Okay? The third step, you write the time of the first IE on the pink vertical line, not on the space, just below your first X. So going back to the example, dumating sa yung patient, pagka-IE mo, 4 cm. So alert line, nasaan ba yung 4 ng alert line? Dito ko siya plinot. Ang susunod kong gagawin, sa ibaba lang nun, dito lang sa space na nakalagay time, you write the time, 8 a.m. Do not write on the space. You should write just below the X. Dito ko magsusulat mismo sa pink vertical line. Bawat isang vertical line signifies 1 hour. Kaya tignan nyo dito, 1, 2, 3, 4, 5, and so on and so forth. Okay? Kaya pag sa space ka naglagay, ibig sabihin nun, 8:30. Pero yung second pink vertical line, 9 a.m. Third pink vertical line, 10 a.m. And so on and so forth. In fact, pwede mo nang isulat yan sunod-sunod. 8, 9, 10, 11, and so on and so forth. Pero, dapat doon sa vertical line. Just below your first X. The fourth step now is to proceed doing the IE. Normally, ang internal exam ay every 4 hours or as necessary. So, ganun lang. Proceed with plotting the X. After i-plot, ilagay sa ilalim ng X on the vertical line yung oras. So, di ba nga kanina yung example natin, nung dumating sa'yo yung patient, X, no? 4 cm, 8 a.m. After 4 hours, nag-IE. So, 4 hours. 1, 2, 3, 4. Which is 12 p.m. Ano yung IE nung 4 hours after? 8 cm. So, karugtong dapat siya nung 4th hour. So, nandun yung 8. Okay? And then, after another 2 hours, nag-IE na naman. So, 12, 1, 2. At nung 2 hours, ano naman yung IE? 10 cm na. So, dapat kapantay din siya nung 2 p.m. which is 10. Okay? So, tuloy-tuloy lang yung oras, ilalagay mo na siya, dapat every hour, bawat vertical line, tapos kung ano yung result, itatapat mo lang siya dun sa oras and then plot X. Tatapot mo sa oras and then plot X. So, sunod-sunod lang siya. Okay? Next, you just have to connect all of the X para ma-determine yung pattern of labor. This example is a very good example of a good labor progress. Why? Kasi perfect lang siya na diagonal line. Okay? Pero minsan may makikita tayong mga unperfect na lines. Alright? Note that based on the structure of the partograph, as soon as 4 cm is reached, cervix dilates at 1 cm per hour. Diba yun nga yung sinabi natin kanina that normally, kapag nandun na sa first stage of labor, or I mean active stage of labor, 1 cm per hour. Kaya normal na normal yung example na ito ng ating partograph. Progress of labor is normal if the plot stays on or to the left of the alert line, which is the green area. So, yung unang example natin is sample 1, no? Yung kanina. Okay? Please disregard this other X. Look at the sample 2, yung color blue. So, I'll give you another example. Sa color blue, nung dumating sa'yo yung patient, no, 5 cm, ito ulit yung alert line. Nasaan yung 5 cm ng alert line? Ito. Okay? So, may oras dapat dyan sa ilalim. Let's say, for example, 9 a.m. And then, yung second, no, 9, 10, 11. After 11, no, 11 o'clock, nasa 9 cm na siya. And then, after another several hours, 1 p.m., nasa na siya? Nasa 10 cm. Just connect it. Okay? So, the progress of labor is normal if the plot stays on or to the left of the alert line. Plotting now that passes the alert line, which is the yellow part, more so if it passes the action line, which is the pink part, indicates an abnormal progress of labor. Basta't nangyari yon, ano yung mga pwedeng gawin? Reassess the woman. You can consider referral, lalo na pag sa lying in lang nanganganak. Baka kailangan ng i-alert ang transport services para dalhin sa ospital. Be alert also for possible cesarean section or an obstetric emergency. Or you can monitor intensively also the mother. Okay? And the last step now, as we are done with the progress of labor, is to note now and record the maternal findings every after IE. Again, on the pink vertical line, not on the spaces, just below the time. So ito yon, may nakikita kayo mga nakasulat sa pink line. Ito yung maternal and fetal condition ng 8 a.m., maternal and fetal condition ng 12 p.m., and then the other pertinent findings. Okay, kapantay. So ano-ano yung mga nandito? Ilalagay nyo lang dyan. So first, vaginal bleeding. So si vaginal bleeding, i-record mo dito, 0 kung walang discharge, plus pag may mild bleeding, plus pag moderate, plus pag severe. So itatapat mo lang siya dyan sa vaginal bleeding just under the time. Okay? Next. Is amniotic fluid. So andito naman yung amniotic fluid. Okay? Ano yung ilalagay mo na symbol? I kung intact, which means hindi pa nabibreak yung BOW or bag of water. C if the amniotic fluid is clear. M kung may conium stained. A for absent. B for bloody. So itatapat mo lang rin siya. Next, no, yung mga sumunod, lahat puro numerical value lang. So, yung nakalagay dito, contractions in 10 minutes, ang ilalagay lang dyan kung ilan. Yung fetal heart rate in 1 minute, ang ilalagay lang kung ilan. Normal is 120 to 160. Temperature in Celsius, so ilalagay mo lang 37, 37.5. Yung pulse is also in 1 minute. So, normal pulse ni mommy, 60 to 100. So, ilalagay mo lang 62, 85, okay? BP in mmHg, ilalagay mo lang kung 90/60. No need for the unit of measurements. Lahat ito, puro lang numerical value. And also, meron din dito, cervical dilatation. So, ilalagay mo lang, dapat parehong-pareho kung ano yung naka-plot doon na X, no? You just need to write there kung 7, 8, 5, hindi na kailangan ilagay yung cm dilation. Okay? Just write the numerical value. Sa urine voided, so may urine voided dito, urine voided, just write yes or no. Nakaihi or hindi. Kahit nasabihin na urine is 120 ml, you do not need to write 120. Just write yes. Okay? Puro yes or no lang. Sa delivery of placenta, write the time of delivery. Again, under the appropriate line, may mga oras ka dyan, di ba? 8, 9, 10, 11, 12, 1. So, kung na-deliver yung placenta ng 125, so kung ito yung delivery of placenta, 125 sa bandang space ka. Huwag dun sa line, kasi yung line is 1 p.m. Pero yung space indicates the middle of the hour. So, 125, lalagay mo katapat ng delivery of placenta. And lastly, yung oxytocin, ganun din. Time given, under the appropriate line, tas lagyan ng slash. Lalagay mo ilang units yung binigay. 10 units, 20 units, okay? Ang oxytocin, ang unit of measurement niyan, units. Hindi siya milligrams, which is the usual. So you can just write open close parenthesis, quote and quote, U. So ibig sabihin na nun, units. Okay? So ito yung example. Alright? Yung time of delivery, di ba, idinagdag mo na, 7:02 pinanganak. So fill up the delivery time. So dito, example, 3, 4, 5, 6, 7, 8. Okay? So dito, plus, ibig sabihin, ang vaginal bleeding nung 3 p.m. mild. Sa amniotic fluid, I. Ibig sabihin, intact pa nung 3 p.m. Contractions in 10 minutes, 3. Tatlong beses nagko-contract sa loob ng 10 minutes nung 3 p.m. Fetal heart rate, 134. Urine voided, no. Temperature, 36.2. Pulse, 78. BP, 110/70. Cervical dilatation, 5. Ibig sabihin itong 5 na to, dun sa taas, dapat meron kang X doon sa 5 cm. Pero dapat nasaan yung X na yon? It should fall on the alert line. Nandun yung X sa tapat ng alert line, sa tapat ng 3 p.m. Okay? Kaya hindi ka dito nag-start ng plot. Kasi pag dito ka nag-start ng plot, ibig sabihin, nung unang IE mo, nasa 4 cm siya. Hindi eh. Yung unang IE mo, 5 cm nga, di ba? Kaya yun yung data mo. So, nandito ka na sa pangalawang hour. Because normally, at 4 cm per hour, ang cervical dilatation. Yun ang ibig sabihin nun. Alright? 4 p.m., 5 p.m., walang nangyari, pero 6 p.m. nag-IE ka ulit. Nung nag-IE ka nung 6 p.m., plus na yung vaginal bleeding, moderate. Pumutok na yung panubigan, clear, kaya C. 4 contractions in 10 minutes, 142 ang fetal heart rate, nakaihi yung mommy, yes, 37.1 ang temp, 86 yung pulse, 110/80 yung BP, at 9 yung cervical dilatation. So, anong in-expect mo kung 9? Sa tapat nitong 6 p.m., dun sa bandang taas, may plot ka ng X doon sa 9. And lastly, nung 7 p.m., may isang data ka na lang na nakuha. 10 cm dilated, wala na yung iba. So, sa taas nito, dapat may nakaplot na X katapat ng 7 p.m. sa 10 cm. Dito rin makikita mo ng 7:30 no, ng gabi, kaya nasa gitna siya ng space, 7:30 ng gabi, na-deliver yung placenta. Tapos, nung 7:05, no, nagbigay ka ng oxytocin, which is 20 units. Kaya 7:05/20, quote-unquote, U. Tapos dito, nanganak si baby 7:02 p.m. Kung titignan nyo ang partograph, nandito siya sa discussion natin ng first stage, but it extends up to the last stage of labor. Kasi nanganak na yung mommy hanggang fourth stage or third stage siya. But it should start, plotting should start in the first stage of labor. Okay? This is a sample scenario. Maria, G2P1, was admitted today at 2 a.m. and IE showed 5 cm dilated cervix, cephalic, intact bag of water, BP 170, pulse rate 88, and a febrile. So, hindi nilalagnat, walang lagnat. Fetal heart rate 140, moderate contractions 3 in 10 minutes at 6 a.m. Bag of water ruptured, clear amniotic fluid. IE is 8 cm. Vital signs were the same as the previous one. 8 a.m. cervix 9 cm, delivered spontaneously at 8:30 a.m. So 10 units oxytocin given IM, placenta delivered complete at 8:35 a.m. So ito yung example niyan. Okay? So now, uulitin ko lang, no? First step, write the data. So, nandiyan yung pertinent data. Dahil wala naman yung date of admission, wala yung LMP, EDD, current AOG, nakalive it blank yan. Pero lahat ng nandoon sa data na meron ka, you have to write it here. Okay? Second step, alamin mo yung unang IE at ano yung kanyang cervical dilation. So, nung 2 a.m. na-admit siya, again, plot on the alert line. So, nung 2 a.m., 5 cm dilated. Kaya nandiyan yung 5. Ayan yung 2 a.m. Always plot on the alert line. The first plot should always fall on the alert line. So, kung 4 dito, kung 5 dyan, kung 6 dyan, 7, and so on and so forth. So, 5 cm alert line, and then below it, write the time, 2 a.m. Para hindi malito, sunod-sunod mo na. Pwede mong lagyan to ng 3, 4, 5, 6, 7, 8 because this means every hour. Okay? Sumunod, ilalagay lang sa ilalim lahat ng data na nakuha mo. Katapat nung oras nung data na nakuha mo. Okay? And then, second plot, nung 6 a.m., this is 8 cm dilated. And then, 8 a.m., it's 9 cm dilated. Dun sa information kasi, walang nakalagay na na-reach niya yung 10 cm. So, kung ano lang yung nasa data, yun lang yung ipa-plot. And then, the following pertinent findings here, no? I means intact, 3 contractions, 140 yung fetal heart rate, 88 yung pulse rate, 110/70, and then 5 cm. Nung 6 a.m., ang sabi, pareho lang yung vital signs. Kaya you just have to write it again. And then, nung 8:35, placenta was delivered. 8:30, binigay yung 10 units ng oxytocin. May nakikita kayong mga blanco, ibig sabihin, walang data. Kung ano lang yung data, yun lang yung ilalagay doon sa plot. So you have to practice and check, practice the plotting. Okay? Going back, according to EINC, ito ulit yung evidence-based researches, IE should be limited to 5 or less. Hindi kailangang oras-oras nag-IE. Again, another is pubic shaving. Pubic shaving in preparation for childbirth is unnecessary and uncomfortable. It should be discouraged. Again, ito yung evidence-based research. Ito yung results, no findings. Dati kasi, automatic, basta manganak yung mommy, shave yung pubic hair. Ang reason, para daw lesser infection. When in fact, study says, if you shave the pubic hair, you open up the pores. And when you open the pores because you shaved the hair, there is increased risk of infection. So no need to do pubic shaving. Just clean the perineum as is. Another is to not recommend the use of enema. Evidence is insufficient to recommend the use of routine enema. When you say enema, you cleanse the bowel. Meron kang pinapasok na rectal tube sa rectum, and then you cleanse the bowel to assist with bowel elimination. Hindi na recommended ito according to EINC. Okay, ang importante, you promote voiding. Importante, nakakaihi yung nanay. Hindi kailangan na yung pagdumi, no? Yung iruroutine enema. Kaya nga doon sa Partograph, meron doong question if voided or not. Important to promote voiding during labor because a full bladder may impede the labor progress. Again, nandiyan yung evidence-based research, nakasulat yung results. Another, routine vaginal douching is not recommended. Ang douching, parang enema, no? Pero counterpart niya yung sa vagina. You wash the inside of the vagina with water or other mixture of fluids. No need to do that as a routine measure for labor. Okay? Another, amniotomy or artificial rupture of membrane should be reserved only for women with abnormal or slow progress of labor. Pag sinabing amniotomy, kusa mong pinutok yung panubigan. Okay? Gagawin lang to kapag nakita mo sa Partograph na may problema dun sa progress of labor. Pero as a routine, you will not do it kasi normally it should rupture in the active phase. If you do amniotomy, you're just increasing the risk of infection. So again, evidence-based. Okay? Next is oxytocin augmentation. When you say oxytocin augmentation, nag-inject ka ng oxytocin to augment the cervical dilatation or the labor progress. You do not inject oxy on the first stage of labor. Kailan pwedeng mag-inject ng oxy kay mommy? Sa third stage of labor. Oxytocin is actually a hormone normally, pero if you inject it, synthetic oxytocin targets the uterus and it improves uterine contraction. But you do not inject oxytocin to the mother on the first stage because of its significant effect to the fetus. Nagkakaroon ng fetal acidosis, fetal distress, kapag nag-i-inject tayo ng oxy nang nasa loob pa si baby. We only inject oxy pag nakalabas na si baby. And that is to assure the fast delivery of placenta later on and prevent excessive bleeding after birth. But oxy should not be given in the first stage. Again, kailan lang pwedeng ibigay ang oxy pag first stage kapag merong abnormal or slow progress of labor. Paano mo malalaman kung meron nun? That's the reason why you are plotting in a Partograph. Okay, routine IVF is also not recommended. There is no study that shows having an IV access will improve the labor outcome. Even prophylactic insertion of an IV line should be considered an unnecessary intervention. Dati, bakit ba naglalagay ng IV line sa nanganganak? Kasi hindi sila pinapakain para hindi ma-dehydrate. Pero ano ang sabi ng EINC? Sa first stage of labor, pwedeng kumain, pwedeng uminom. Dahil basta yung ipapakain mo ay madaling ma-digest. easily digestible foods. Pero ano yung sabi din ng EINC? Kailangan may freedom of movement habang nagle-labor, lalo na pag first stage at hindi pa pumuputok yung panubigan. Yung routine IVF will just impede the freedom of movement. Ano pa yung result ng mga study? Pag nag-insert ka ng IV, you're just increasing the risk of infection dahil nag-i-introduce ka ng pagtutusok doon sa blood vessel ng mommy. So, no IV is better. Okay? Fasting during labor is a tradition that continues with no evidence of improved outcome. So again, yan yung research, nakalagay dyan yung result. Hindi na kailangang mag-fasting, hindi kailangang NPO sa first stage kasi pwede namang kumain at uminom sa early stage of labor, basta easily digestible. Kasi pag sobra silang nagutom, tas dumating na yung time, no, ulitin ko na pag pinapush na mommy push or iire yung mommy, wala na siyang energy to push. Kasi gutom na siya dahil hindi mo siya pinakain nung nag-start lang yung labor. But what's important here is you just monitor the food and fluid intake. Okay, now let's go to the second stage of labor. In the second stage of labor, kailan siya nag-umpisa? Full effacement dilatation, 10 cm dilated, 100% effaced, nag-end sa birth ng baby. Okay? Now, continuing with the EINC checklist. Ito yung part ng EINC checklist nyo na yung mommy ay dinala sa delivery room na. Okay? But before this, no, lahat ng delivery room area according to EINC should have already dexamethasone. Dexamethasone is a steroid. All delivery rooms must have dexamethasone for possible emergency deliveries. What if in the delivery room, biglang may dumating na nanay na emergency delivery tapos hindi pa naman full term, no? Or other complications. Ang threat, ang risk is to the fetus. But because you cannot halt labor anymore, lalabas yung baby, ang unang-unang kawawa kay baby ay yung kanyang lungs. Baka mahirapan siyang huminga at mag-cope sa extrauterine life pag pinanganak siya ng kulang sa buwan. But giving dexamethasone to the mommy during that time will improve the outcome. According to research or evidence-based research, dexamethasone as a steroid will cross the placenta. At pag-cross ng placenta, meron siyang significant effect sa lung surfactant ng fetus. And recalling the lung surfactant, no, yung LS ratio na topic natin nung pregnancy, yung LS ratio or the surfactant will prevent alveolar surface tension, especially during expiration. So, mape-prevent yung lung collapse or atelectasis kay baby kasi sa pagkakataong ito, mas magmamature yung kanyang lungs. Ang normal dosage ng DEXA na dapat ibigay kay mommy, 6 mg IM Q12 times 4 doses. Okay? Now, looking at the ampule, no, going to pharmacology, sa pag-compute nyo, D over H times Q. Ang desired dose, 6 mg. Ang dose on hand, if you look at the ampule, it's 4 milligrams per ml. So, D over H times Q. 6 mg divided by 4 mg times 1 ml. So, per injection, ang ibibigay mo kay mommy ay 1.5 ml. You give it every 12 hours for 4 doses. That will significantly improve the lung surfactant of the baby. The question is, paano kung hindi naaabot ng 4 doses? Kasi pag titignan mo yung Q12 times 4 doses, 48 hours. What if hindi na umabot ng 48 hours, lumabas na yung baby? Will you still give the dose or not? You still give the dose. Kahit isa lang. Because giving one is more beneficial than giving none at all. So, ibibigay pa rin siya as an emergency measure. Okay? Ngayon, I am ito. So again, I am siya. Hindi mo kailangan ng IV line. Sabi ng EINC, no need for an IV line. You can inject this, I am. The same with oxytocin that I mentioned a while ago. Oxytocin should be given third stage of labor, but also I am. So you do not need an IV line unless there's really a complication. So going back to the checklist, alam kong na-discuss na sa inyo ito, at minimemorize nyo to para sa inyong RETDEM. So, in preparing for delivery, check the temperature in the DR. No? Dapat yung temperature nasa pagitan lang ng 25 to 28 degrees Celsius para si baby paglabas ay hindi mag-hypothermia. You also check for air draft to prevent hypothermia. Ano yung air draft? So, you just hold a tissue paper, hang it in the air, and if the tissue is moving, may air draft. The tissue should not be moving as you hold it in the air, which means there is no air draft, there's a lesser risk for hypothermia, lalo na kay baby. Okay? See, number 5, comfortable position during delivery. Usually, ang comfortable position is semi-upright. Okay? Hindi na nire-recommend ang lithotomy position. Because lithotomy position, yung lower extremities ng mommy, nakahang, very uncomfortable sa stirrups na bakal. Tapos yung buttocks area niya almost hanging. Ang sabi ng EINC, comfortable position. If the mother feels that the comfortable position is this one sa panganganak, that's better. Except a standing position. Kasi mahirap i-catch yung baby pag nakastand naman yung mommy. But majority of the mothers, ang comfortable position niya during delivery is a semi-upright position. And later on, we have a photo showing that position. Ensure the privacy. 7 is remove all jewelries, wash hands, WHO 1, 2, 3, 4, 5 procedure. So, ano yung procedure na yan? Palms to palms, between fingers, back of hands and fingers, thumbs, fingertips, and even the wrists. Number 8, no, prepare a resuscitation area if in case there will be problems pag labas ng baby. Number 9, arrange the equipment. No? Si 9 and 10, yan yung magsasabi sa'yo, tutulong sa'yo para malaman mo yung susunod na step na nire-recommend ng EINC. Okay? It says there, oxytocin injection, usually 10 units. At when do you give it? Right after birth of the baby. There's another oxytocic for uterine contraction, that's methergine. Before, methergine is used. But now, EINC says, do not use methergine. Methergine can cause sustained contractions and it can lead to placental entrapment and hypertension. Mas marami siyang delikadong side effect. So we only recommend now use of oxytocin. Okay? Also, makikita natin dyan sa step number 10, yung stethoscope and then the injections. The stethoscope symbolizes physical exam, which means check mo muna si baby from head to toe cephalocaudal. Okay? Bago ka mag-inject. To make sure that whatever you see in the baby is not an effect of the injection that you did. Okay? Yung mga injections, no, you've discussed that sa RETDEM for sure, pero again, no, just to reiterate, yung mga gagamitin nating cotton balls is even changed, no, by EINC protocol. Sa vitamin K, pwedeng gumamit ng cotton balls with alcohol. Pero sa mga vaccines such as Hep B and BCG, sabi ng EINC, cotton balls with water lang yung gagamitin para doon. So, kailangan cool boiled water, no, sa cotton balls. Why? Kasi yung alcohol daw may actually kill the organisms or yung effect ng vaccine na i-inject kay baby. Okay? So, yung 11, again, clean perineum. Ano yung sabi? No need for pubic shaving. Wash hands again, WHO procedure. And then 13, put on 2 pairs of gloves. Bakit 2 pairs of gloves? Yung first sterile glove is for the mommy, no? Second, yung kapag nag-a-assess na rin tayo or uh, inaasikaso na natin si baby. Now, remember this, EINC is designed for only one person. Kaya ganyan yung number 13. Pero kung dalawa naman kayo na mag-a-assist for the birth, you do not need to do double gloving. Okay? Uh, ito yung sinasabi natin na pag-delivery na, the position is a comfortable position. Usually, it's the semi-upright position. During labor, anong nire-recommend ng EINC? Any position of comfort, freedom of movement. Pero sa delivery, yung best position is the semi-upright position. So, prepare the place of birth. You have to wear scrub suit, yung gown, yung cap, yung mask. And positioning the woman like this. Ito yung upright position. No? Nasa kama pa rin siya na normal, dorsal recumbent, nakabuka ka, pero yung kanyang chest at yung ulo mataas. Okay? This position promotes second stage pushing. Mas magaling umire pag nakataas yung ulo at yung chest ng nanay. Okay? Kapag ang nanay ay nasa labor na, lalo na pag nagpupush na siya, second stage lang pwedeng mag-push, second stage lang pwedeng umire. Kasi nga dapat ang cervix fully dilated. The cervix is a very fragile tissue. Pag umire ka nang hindi pa siya fully dilated, baka mapunit or may cervical laceration. So again, no, pag ganito na yung stage ni mommy, yung uterus niya, imagine niyo yung uterus na hati sa dalawa, transverse. The upper part of the uterus is very active. It's very strong because it aids in pushing. And the lower part of the uterus is soft and relaxed. It is passive for easier passage of baby. Another important thing, when the mother pushes, no, the mother should push with contraction. And the mother should rest between them. So, ang pag-ire, dalawa ang criteria. Ano yung unang criteria? As I mentioned a while ago, kailangan 10 cm dilated. Ano yung pangalawang criteria? Dapat nagko-contract ang uterus. So, going back to the graph that you saw a while ago, di ba yung graph na naka-curve, increment, acme, decrement, na ang duration ay nasa 60 to 90 seconds. Sa panahon na yon, doon pwedeng umire ang nanay basta 10 cm dilated na. Pero pag nandun siya sa relaxation phase, kahit 10 cm dilated na, pero nasa relaxation phase yung uterine contraction, do not let the mother push. Okay? So, continuous doon sa ating EINC checklist at the time of delivery. So again, encourage the mother to push as desired. No forced coaching. Okay, and then 15, so dinadrape mo yung linen. I'll not go further on this one kasi again, nasa RETDEM nyo yan. 16, perineal support and control delivery of the head. Ito yung Ritgen's maneuver. This will prevent laceration. Okay? Paglabas ng baby, call out time of birth and sex, and of course, inform the mother of the outcome. Alright? Another is yung selective or non-routine episiotomy. Evidence-based ulit, hindi na dapat routine ang episiotomy. Episiotomy is the intentional cut doon sa fourchette to allow a larger opening and prevent laceration. In fact, may mga iba nga nag-episiotomy na naglacerate pa. So, hindi na siya dapat routine. Selective na lang. Okay, monitor for lacerations. Sometimes, no, Pwede ring bigyan yung mommy dito ng prophylactic antibiotic, lalo na pag yung mga lacerations nila nasa third or fourth degree, umaabot ng rectal area. Okay, but again, we'll further discuss that sa postpartum period. Ito naman yung binabanggit doon sa checklist nyo na perineal support and controlled delivery of the head. You assist with birth, no fundal push, definitely. Pag sinabing fundal push, tinutulak mo nung nagpapaanak yung uterus ng mommy para lumabas si baby. That has a very significant effect sa fetus, especially fetal acidosis. So again, paglabas ng baby, no, yan yung Richens maneuver to prevent laceration. Kaya kita mo dito, sinusuportahan ng isang kamay yung perineum para ma-prevent yung laceration. Ito naman, sinusuportahan yung head na lumalabas. Paglabas ng baby, syempre introduce the newborn to the mother. Ito yung fundal push, evidence-based. Fundal push or fundal pressure during the second stage of labor results in significantly higher incidence of second-degree perineal tears, lalo na ang fetal acidosis. I cannot assure you that you will not see fundal push in actual delivery rooms. Minsan, may mga doktor mismo na nagpo-fundal push. That's not right. That's not correct. And that's not evidence-based. Okay, third stage of labor. So third stage of labor, nag-umpisa siya, lumabas na yung baby hanggang lalabas ang placenta. Alright, so ang placenta, no, paglabas, in the photo you can see two kinds of placenta, the Duncan and the Schultz placenta. The Duncan is the dirty placenta kasi maternal side siya. Yung Schultz is a shiny placenta kasi fetal side siya. Yung mechanism ng paglabas niya, no, fetal side, yung nag-cover nung napunit siya or nag-shed siya from the uterus, Schultz. Pero pag yung nag-cover nung napunit, yung dirty side na maternal side na naka-attach mismo dun sa uterus, that's the Duncan placenta. But it's not really important to identify if it is Duncan or Schultz. What's important is paglabas ng placenta, you inspect for its completeness. Kailangan kompleto yung cotyledon. Kasi pag may naiwang placenta sa loob ng uterus, that will cause, number one, incomplete contraction of the uterus after birth. And that will cause hemorrhage. Pangalawa, baka mabulok dun yung placenta, it will cause infection. Okay, again, those are already postpartum complications. Now, before, no, this is very new to EINC. Before, even during my time, nung ako yung student, ang placental delivery is just passive signs of placental delivery. You just wait. Wala kang gagawin, intayin mo lang na lalabas ang placenta. At ano yung mga passive signs? Intayin mo na yung cord biglang hahaba, biglang may bubulwak na dugo, and lastly, may change sa shape ng uterus ni mommy from a flat, nagiging globular. So, iniintay lang yung tatlong yon. Pag nakita mo yung tatlong yon, ito na, i-assist mo lang, lalabas na yung placenta. But now, according to EINC, do not wait for the placenta to be delivered. Do not be passive. We should be active. We have to do something para mabilis lumabas ang placenta. At pag mabilis siyang lumabas, nape-prevent yung hemorrhage. And again, going back dun sa EINC kanina, hemorrhage is the leading cause of maternal mortality and morbidity. So para wala ng hemorrhage, let's be active para mas mabilis lumabas ang placenta. Very recent study by Plendeville, again, nandiyan yung evidence-based practice. So ang tawag dyan, active management of the third stage of labor. At ang active management of the third stage of labor ay may 4 na component. So do not just wait for the placenta to be delivered. Do something. Ano yung una? You give oxytocin IM. Kaya nga sabi natin, you give oxytocin IM on the third stage. Paglabas ng baby. Okay? Kapag nag-contract yung uterus, pagkabigay mo ng oxy, mas mabilis lalabas ang placenta, mape-prevent ang hemorrhage. Do not give oxytocin on the first stage because the baby is still there. Unless there is an abnormal progress of labor that you can see in the partograph. Second component of active management of third stage of labor is properly timed cord clamping and cutting. Yung umbilical cord, ika-clamp at ika-cut mo within 3 minutes. Noon, no, before, evidence-based ulit, before, minimilk mo pa yung cord para yung dugo dun sa pusod, madala mo kay baby. No? So, we do not do that anymore. Kasi mas tumataas yung risk na mga blood problems kay baby when you do that. So, kailangan within 3 minutes, putulin siya. Ano yung iintayin mo dito para maputol mo siya? When the cord pulsation stop. We learned during pregnancy that the umbilical cord contains 3 blood vessels, 2 arteries, and 1 vein. So, pumipintig siya. Ngayon, pag hindi na pumipintig, no, pagkalabas ng placenta, pag hindi na pumipintig, no, when cord pulsation stop, you can cut the umbilical cord, okay, while waiting for the delivery of the placenta. Third is controlled cord traction with counter traction. So, on one end, tinutulak mo yung pusod para lumabas yung placenta. On another end, tinutulak mo rin yung uterus on the opposite side. No, yun yung counter traction para mas mabilis yung paglabas ng placenta. And lastly, massage a contracted uterus. Ito yung Creed's maneuver. Gentle pressure of a contracted uterine fundus. Doing these 4 components will best manage the third stage of labor to prevent hemorrhage and the other complications of birth that leads to maternal morbidity and mortality. So first photo, inject IM, oxy, pagkalabas ng baby, no? 10 units ang usual dosage niya. And this will aid in the contraction of uterus, lalabas ng mabilis ang placenta, prevent hemorrhage. Yung second, properly timed cord clamping and cutting. Paglabas ng baby, intayin na mawala yung cord pulsations in 3 minutes and then cut. Do not milk the cord anymore. Yung pag-cut, no, diba, dapat at least 2 inches from the base. Okay? The third is controlled cord traction with counter traction. So, hinihila mo dito yung pusod. So, wala na si baby. Nakat mo na yung cord eh. After nun, hilahin mo dito. Gentle pressure. And then the other hand naman on the opposite side, counter traction ng uterus. And lastly, massage a contracted uterus. Okay? So, paglabas ng baby, no, for the first 30 seconds, no, again, continuity, kadugtong ito nung checklist ninyo. Si baby, dry linen, ipatong sa abdomen ni mommy. Punasan thoroughly si baby, starting from head down. So, ang pagpupunas, meron din siyang pagkakasunod-sunod. Unahin ang mata, sunod, face, next, yung neck, next, nape or batok, sunod, anterior chest, posterior chest, the arms, and the legs, pati yung mga singit, no? Ngayon, importante na hindi pinupunasan yung palms. yung palad ng baby. Why? Yung secretion ng glands ng areola is the same scent sa secretion ng amniotic fluid. So si baby, kapag naamoy niya yung kamay niya, andun pa rin yung scent ng amniotic fluid na kinasanayan niya nung nasa loob siya ng uterus. Which means, nandun pa rin yung familiarity. At kapag naaamoy pa rin niya yon, na-attract siya, yung amoy ng lumalabas sa Montgomery's glands ng breast, kaamoy nun. At pag magkaamoy silang dalawa, it will assist the baby sa breastfeeding. Kaya lahat dinadry. Pero ang sabi ng EINC, do not dry the palms. Okay? Continuous din. So ito yung karugtong pa rin nung inyong EINC checklist within 1 to 3 minutes. So tanggalin mo na yung wet cloth na pinampunas mo. No? Tapos skin to skin contact ka na kay mommy and the baby. Gaano katagal itong skin to skin contact? 90 minutes. And then 23, takpan si baby ng second linen dun sa likod niya. Okay, 24, takpan din yung head ni baby. 25, exclude a second baby. Siguruhin na hindi siya multiple pregnancy. Okay, kasi magbibigay ka na ng oxytocin paglabas ni baby. Okay, ito na yung start ng active management of the third stage of labor. 26, tanggalin mo na yung unang set of gloves mo kung mag-isa ka lang na nagpapaanak. Kasi may susunod ka na step kay baby. Okay? So again, 'di ba, kanina sinabi ko na before everything starts, kailangan may decontaminant na solution. So doon ka magdi-discard ng mga gloves, no, na tinatanggal mo doon sa ating commercially available yung Sidex usually or yung 0.5% chlorine solution. Usually 10 minutes siyang dinedecontaminate. 27, wait for cold pulsations to stop. And then 28, ilagay yung clamp. And then 29, cut. Okay, 30, perform the remaining steps of the active management of the third stage of labor. Okay, so si letter A, yan yung controlled cord traction with counter traction, at si B, yan yung binanggit kong massage uterus until firm. Kasama niyan yung previously na pangatlo, IM oxy, pang-apat yung cord clamping. So, natapos mo na sa stage na ito yung active management of the third stage of labor. Okay, and then 31, syempre inspect the vagina, the perineum, may laceration ba? Kung may episiotomy, may kailangan bang tahiin? 32, examine mo yung placenta, kompleto ba yung cotyledon? 33, linisin si mommy, clean the perineum, lagyan siya ng pad. 34, kumusta naman si baby? Humihinga ba? Anong color niya? Check the mother also. Comfortable ba sila pareho? Contracted ba ang uterus ni mommy? That's very important. Okay, 35, i-dispose yung placenta, leak-proof container or plastic bag. 26, yung nag-decontaminate ka ng instruments mo, no, at least 10 minutes. 37, skin-to-skin contact, continuous pa rin yan. Dapat nakaprone pa rin si baby sa chest ni mommy, no? And importante din yung breastfeeding, okay? Again, yung mga part ng baby dito, we will further discuss that sa newborn. Okay? Pero magkahalo kasi sila sa EINC. Yung kasunod na part nitong checklist ninyo, yung next 15 to 90 minutes in the checklist is for newborn already. So we will include that in the newborn lecture. Okay? So fourth stage, last stage, is the birth of placenta to the birth of the baby. So dito, napaka-importante ng monitoring. Check vital signs of both the mommy and the baby. So mag-provide ng hygiene and comfort close observation. Kasi sa panahon na ito, uh, sudden drop in the hormones, no? Importante hindi siya mag-hemorrhage, walang komplikasyon kasi dito nag-bleed na siya. Nung pregnancy, there is no bleeding. But after birth, there is bleeding. And we really need to monitor the mommy as the mommy goes back to the pre-pregnant state. Okay? That's the end of our topic for labor and delivery. So study well, practice the partograph, uh, and also again as we go through the discussion, no, yung three previous topics natin, from the moment of sexual health, reproduction, menstruation, hanggang mag-pregnancy, at ito nanganak na si mommy sa labor and delivery, dugtong-dugtong yung mga events or happening. Okay, so I hope you learned about labor and delivery and study well for the upcoming exam.